First of all, Dr. Kuldeep Dutta, welcome to Bharat Marg. Dr. Saab, we are so happy you are here with us and you gave us time. I really want to thank you for this. We are here to discuss about a very important subject. You were talking about how to expand the capability. In India, there is too much of COVID cases happening, and you were talking about how to increase the capacity of the hospitals, where people are struggling to get a bed. And also we would like to discuss about the individual struggles that people go through, when this mahamari or jo bhi aap bolte hain, the pandemic, when it affects an individual's home, it's a different, when it till it comes to the next door neighbor, it's different story. When it comes into our home, it is totally a different story. We face the reality, so we will discuss about these things, how to handle it, and we are happy you are here. Okay, please say us what the government should do. They are putting, like I put 2,000 beds here, 2,000 beds there, but by the time they are installing 2,000 beds, already there are 5,000 patients.
I think Sundarji, thank you very much for having me. I can give you a perspective from a clinician's point of view, and I am not an expert in epidemiology. I am not an expert on virology. I'm an internist, basically dealing in cardiology only. So it'll be more from a clinical day-to-day practice and what I see, and what I'm going to be talking to you is mainly based on a talk given by Professor Dr. Devi Shetty from Narayan Hyderale, Bangalore, and some inputs from Dr. Harsh Mahajan from Mahajan Imaging Center, Delhi, and then Randeep Guleria from All India Institute of Medical Sciences, Delhi. So I've borrowed a lot of things from their talk and added some of my own perspectives to it. So what I tend to go through with you in a few minutes is that at the moment we have a positivity rate of 20 to 30%, and it's going to stay for the next 4 to 5 months or 6 months. So if we take 20 to 30% as positivity rate, and the current rate of positive cases in India is about 3 to 4 lakhs, or hovering around 4 lakhs. So for every positive patient that we pick up, there are 5 patients that we are not picking up. So if we take it at 3 lakhs, it's 15 lakhs. If we take it at 4 lakhs, it's 20 lakhs. So average, we are having 20 lakh patients per day, right? So, and 5% of these would need hospital beds. Now, hospital beds need oxygen beds also, and may mean ICU beds also. The current total availability of ICU beds in the country is 75,000 to 90,000 as per Dr. Shetty's figure, and I have also checked. I tend to agree with that. Now, if we are going to have 75 to 1 lakh patients per day, so those beds are occupied on the first day. So what are we going to do tomorrow? So we need to increase the capacity of the oxygen and ICU beds to something like 5 lakhs and above in the next couple of weeks, maybe 2 months. How do we do?
But one quick question here, sorry. Most of our stadiums now, people are playing IPL and other sports, whether they need to be converted to hospitals too, the arenas, sports arenas, etc.?
You see, you have to find additional space, and you'll have to find, structures. The stadia may not afford you all the structure. You need a roof over the head. So, it's actually colleges and schools and their verandas which are more apt for converting into wards and can be quickly converted. So they have to be commandeered. And open arenas and fields may not be, they may be all right, when you have an earthquake or something, but something like this, they may not be the proper, space which you're looking for. So coming back to if if we can create the facility for admitting so many patients, then the facility does not treat the patient. The patient is treated by whom? By the nurses, by the paramedics,
True.
and by the doctors.
True.
And at the moment, the government hospitals face a deficit of something like 78% of staffing all across India. That is huge, huge, huge. And getting more ventilators, getting more oxygenators, getting more BiPAP machines will not treat the patient. You need the nursing staff. You need nursing staff on an 8-hour shift. You need doctors on an 8-hour shift. You need paramedics on an 8-hour shift. So it is a whole logistic support which is needed, which has to be upgraded, which has to be filled up in the next few weeks, maybe 2 months at the maximum. So how do you go about doing it? So Dr. Devi Shetty and others have given a very good roadmap for it, which every thinking individual and the policymakers sitting in Delhi, they are looking at it, and they should look at it very closely and implement it as fast as possible, as they say ASAP, as soon as possible. And not waited for okay, we'll do it next Monday. No, not next Monday. Can we do it tomorrow? So that is how fast it has to be done. So we'll come to the first rung. When the patient gets there, who's going to be attending on him first? It's the nursing staff. So where do we get the trained nurses? Trained nurses, you can't pick them up from somewhere and bring them here. So you have 22 lakh nursing students who have completed their BSc training program for 3 years, and they are just waiting for an exam so they get a certificate, okay, they have done their BSc training. But they have gone through the education curriculum. Now these 22 lakh nurses can be inducted into the hospitals, into the COVID facility, into the oxygen or ICU beds, wherever. And it is not that you are expecting them to, manage the patient. They can assist another nurse. So take the load off. Supposing there are 10 nurses working who are trained. Now with these additional nurses, only 5 would be working and 5 would be taken off. So 5 would be taken off. So you have the full complement working, and they get training on the job, and you have 22 lakh more hands to manage the patients, and the paramedics also. Now the next question is, where do you get the doctors from? At the moment, as I confirmed today, and I hope my figures are right, that 20 lakh foreign educated doctors in India who are waiting for certification so they can practice in India. They have all been educated in Russia, Ukraine, Yugoslavia, Romania, Philippines, China, Nepal. And with the degree, they are authorized to practice in their country where they got educated. But in India, for uniformity's sake, they have to go through an exam. Now these 20 lakhs or 5 lakhs, whichever is the figure, even 5 lakhs is not a small figure. They ought to be inducted into the COVID facilities, whether it is the ward, whether it's the oxygen bed, whether it's the ICU bed, and seconded with a attending consultant. So they are working under his watch, and they are doing on-the-job training, and you have so many more hands to handle the patient, to give him oxygen, to put in a drip, to give him a drug at the time, under the instructions of the attending physician. So it is not as if you have put in some untrained person there. So while I'm advocating, the foreign medical graduates to be inducted, the government of India has an Ayush program. In the Ayush program, you have the Ayurvedic doctors, you have the BIMS doctors, you have the RMPs. They also need to be inducted, and they are not going to be working on their own. They are just additional hands working as auxiliaries with the attending and the consultants, and taking the load off the trained people who can be better utilized elsewhere. So it's like one trained guy having 2 or 3 untrained guys with him whom he trains, and the work is done. And so you work as a supervisor, and under you there are 3 other people who are working the job, and you're supervising 3 of them. So that is how you can make a chain and make the manpower capacity which is required come true.
Absolutely. And there are a lot of medical colleges run privately also, right?
So now this was I was talking of the foreign medical graduates. Now coming to the Indian medical graduates, once they graduate, 1,35,000 MBBS graduates who have completed their internship, they sit for the NEET examination for going into post-graduation. So there are only 35,000 seats for post-graduation in India. So that leaves 1 lakh doctors who will be sitting for the NEET next time. These 1 lakh doctors need to be inducted into the COVID management program of the COVID hospitals, and after they complete their 1 year, they should be given some marks as weightage when they compete in the NEET for having worked in a national cause, in a national calamity. So government has to give them some leeway, some incentive for working. So you have 1 more lakh doctors available to you, and the 35,000 doctors which have gone into a specialty training program, they've got inducted into a postgraduate or a postdoctoral program. It's a 2-year course, whether it's postgraduate or postdoctoral. They should spend 3 months of their 2 years into a COVID ICU facility because they are better trained. They need not be put in the wards, they need to be put in the ICU, and in 3 months their services ought to be utilized. So you build up 2 lakh plus doctors who are trained in India.
Absolutely.
And then now we come to the MBBS doctors. So there are roughly about 25 young doctors who are doing their MBBS every year who are coming out. Maybe 25 to 45,000 doctors are coming out. They do 1 year internship. That's 12 months. So out of the 12 months of internship, 3 months is supposed to be rural service, which we call social preventive medicine. So those 3 months, all these 40,000 doctors should be available for working as extra hands in the COVID facility for the oxygen and ICU beds. And it is not that they are treating a patient. They are helping the consultant manage the patient by putting in a drip, by giving him injection, by putting on the oxygen, by adjusting the oxygen cylinder, by adjusting the ventilator. So they are additional helping hands where the trained people can supervise 3, 4, 5 people, and you have qualified people working there.
Absolutely.
So this is how capacity building in the crowd is done. This is how capacity building is done for any program. So having said this, now I'll come to the last part. What is a disaster? A disaster is any natural or man-created calamity which overwhelms your existing civic amenities or civic facility. So at this time what has happened is this is a biological agent which has overwhelmed the medical facility available in the country. So that is why the government has invoked the Disaster Epidemic Act, which is dated, but the new one is 2005, and under the 2005 Act, the NDMA, which comes under the Prime Minister himself, has the NDRF, the National Disaster Management Force, which is 14,000 people who are mandated to treat nuclear, biological and chemical, also called CBRN, chemical, biological, nuclear and radiation and nuclear, CBRN. So they are trained for this kind of thing. So they ought to be inducted into the management, and the territorial army needs to be inducted into the management of this huge, humongous crisis in a very thick populated, vast country of ours. And seeing the uniformed people on the ground, on the streets, managing the logistics will shore up the morale of the patients, which is at an all-time low. With there's hardly a family which has not lost somebody. There's hardly a doctor who does not know that he lost one of his colleagues. There's hardly a hospital which is not a nursing officer or a paramedic or a doctor or somebody. So I think this also needs to be looked at.
You were saying that so many doctors coming inside, nurses coming inside, etc., as an emergency force. Will they face any risk of losing their life, or how do the government assures them that they are behind them?
They should have an insurance minimum 50 lakhs to 1 crore.
Okay, you mean even the karmacharis like the nurses,
Yes,
sweepers?
why not? They are human beings.
Absolutely, I agree with you. And
They have a family. They have a family. They have parents. They have children.
absolutely. And do you think government can do this?
Why not?
So 50 lakhs to 1 crore minimum should be there.
Yeah, insurance cover if anybody comes to COVID.
Right. And we were talking about this one aspect you were going through in detail. Please, if you can brush up on it a little bit on that. Corruption in the hospitals that happens are, they give all kind of reasons. We had to buy PPE, we had to buy this, we had to, see, I was talking to a hospital insider, one of the hospital which will make one ward that will make 2 crores in a year has already made 9 crores. Okay. It's a huge hospital, corporate hospital, and now, but the doctors are not overpaid or overtime or anything like that. They had to stand with the PPE all day long, right? And it is a tiring thing for them. You cannot put the AC because of the virus spreading. They go through a lot, they are charging almost like 50,000 for a common bed and 1 lakh for the ICU bed if you are lucky, and sometimes that can bump up if there is a huge crowd. They can bump it up to the highest bidder. How do the common person, like 10 people are on the line, one person says I'll pay 3 lakhs for that bed and he gets it. Do you agree with me on that?
No, if it is being done, then it's a failure of the administration, and the administration should see to it doesn't happen. If I was a district magistrate and it was happening in my district, the buck stops at my table, and I'd see to it doesn't happen.
But they don't. There is no trace for it, doctor. They don't.
No, there is always a trace.
They don't want to take the insurance. They say we don't take insurance. What the people will do?
How will he dare?
Okay, let me put it this way. Sometimes the third party insurance, they are associated with a different network of hospitals where there is no bed.
Sir, Sundar sir, it does not make sense. If there is a national disaster, a national calamity happening in the country, the government is duty bound to put in steps in place that are followed by everyone, irrespective of who he is.
But do you think government listens to us?
Government should. We should make them listen. It's our job.
Absolutely. Because I'm hearing the ambulances overcharging. They refuse to take
It's all bad administration. It is all bad administration, and they have to be called out, no matter who it is.
Who you will hold accountable? Central, state, district level officials? Who is in charge of it?
The chief minister, the health secretary, the district magistrate, everybody down the line, and health minister, government of India, the prime minister's office, anybody, everybody.
But this is a massive calamity. There is no question about it. And I was saying you, one of my friends who came out of the COVID, they got a 21 lakh bill between the husband and the wife.
The planning has to be, because it's a national calamity, it is across all states, and health is a subject which is on the state list also, in the concurrent list also. So it is the Union of India which should lay down the rules, and they see to it that they are followed. And anybody who's not following it should be put away.
But what if somebody who gets a bill of this much and they recover and come, how they are supposed to live, doctor?
What you're telling me is the failure of administration. It is not the failure of the medical doctor. It is the failure of the administration, failure of the system which is allowing it to happen.
Right. Absolutely. Because it is more devastating. Sometimes people say that recovery is good or bad. And many times the breadwinner goes off in the COVID, then what happens to the family?
That Sundarji, is the responsibility of the government.
Okay, what happens if the breadwinner goes off and rest of the family is in the financial mess? They are depending on the breadwinner. What happens?
So government has to ensure an insurance scheme for natural disaster for every citizen of this country.
Why the government didn't do yet? Because so much is happening. Why the government is stepping in and with the insurance plan yet?
It is not done yet because the MP or MLA who comes to meet me, I don't push him. The moment I start pushing him, it will happen.
And one more thing, what we see is, sometimes the elderly abuse that, if the elderly gets a COVID, many times the in-laws in a giant family, they feel that it is a kind of a very torturous things for them. They brought the disease inside. Sometimes they are sent to the hospital, but after that they don't have money. Even though they have the heart, they don't have money to pay the bill and bring them home. So
that again, we are coming back to the same thing again and again. People have to be insured, and the rich are insured already. It is the middle class and the lower middle class whose insurance has to be done by the government.
And do you think it is doable at this stage?
Why not?
One of the things is, when the children or elderly goes into the isolation.
Those are logistics where psychotherapists and psychologists have to step in.
So that to avoid the stress, they need to have a psychological this thing.
Yes, the people will have trust if the systems are put in place. If I ring up and the ambulance comes, if I ring up, the doctor picks up the phone, and if they see the NDRF uniformed people on the street, they see uniformed people manning the ambulances, people will get the confidence back. They see the territorial army units, manning important places and professional management of the helplines. If they see that happening, confidence will come back in 1 week.
But Dr. Saab, you know that Rohit, the anchor who died recently, the Ajtak anchor, one of the VIP anchors, and his wife says that the doctor never picked up the call. You cannot blame the doctor because he is overstressed or she is overstressed or whatever the reason could be, but at the end of the line we lost one of the very good person, out of many. My question is simple. If that is happening for a VIP, what about the common people?
I would not like to classify anybody as a VIP or as a common man. The patient who walks in through the door to my hospital is the most important person. There is no such thing as VIP, right? Having said that, why is it happening is because the hospitals are understaffed. The doctors are overworked. When I ring up Sundar, I expect that Sundar is free, but Sundar must be seeing 3, 4, 5 patients and he's not picking up my phone. So we need to build up the capacity of the doctors and the nursing staff and the paramedics in the hospital. And Dehradun, I can tell you, I had a question to ask to one of my juniors who's 10 years my junior. I sent a SMS to him and he got back to me by evening. So I know there's no way that he'll not answer me. But he's busy dealing patients. People are not ready to go and look after the kith and kin in the room next door. And here is a doctor who's working in the COVID ward 24/7. Can you imagine the amount of risk and stress that he's taking?
Absolutely. There is no question about it. We are totally thankful for what they are doing. There is no question about it. And
so give him some relief. Get more get more doctors on the job.
Absolutely. One last thing, Dr. Saab, one last thing. Many times when the COVID comes into a home, they are very afraid. They think that their life is gone. They are, how they feel when the pandemic, they heard so much about it on the TV and everything, and now it is in the home and they are very scared. What is the reality about the COVID? If it hits a home, they are done, or what is it? Can you please give some message? No. Can you please give some confidence to these people?
See, only 5% of the infected people will require hospitalization. 95% of the people are going to get all right. So there's no need to panic. It's type of an influenza, but it's a different virus, and there is reason to believe that it may not be a natural virus because it is mutating too fast. So it is more infective. So you have to take universal precautions. Treat every patient, every person that you meet as a COVID positive patient. And use your mask, use your hand sanitizer, use social distancing, and that's the way to go. You have to live with it. And you can't, wish it away.
And if anybody gets in the home, don't get panicked. and just take it easy and do the required.
Don't panic.
Anyway,
Yeah.
thank you, Dr. Saab, for your time. Thank you for guiding us on this difficult time. Appreciate it highly.
Yeah. Thank you.